start very quickly. So I won't focus on whole US system. It's impossible because it's very complicated system, complicated by government regulations. I talked to today about last so-called healthcare reform and known as Obamacare, and I will, based on my book released 2 years ago, The Economics of Obamacare. So I will talk a little about this agenda, a little about Obamacare regulations, special phenomenal characteristics for health insurance business called death spiral or affordability spiral, and I show how these regulations, government regulations, Obamacare regulations, created a big mess on so-called quasi-market health insurance marketplace, or in other words, marketplaces. There are special healthcare insurance markets created by government and heavily subsidized by government. And I will show you why Obamacare is so problematic, why Obamacare couldn't solve problems with US healthcare. And last short summary and literature if you want to study this subject. So if we're talking about Obamacare regulations, we should back to 2013 because it's last year before Obamacare. And as you see, this is this table shows access to medical benefits in this year, and most of people were insured, and still have so-called group health insurance plans offered by employers. And the problem was, also you can see we have Medicaid, Medicare, military insurance, there are government programs. So it isn't true that in United States you have unhampered free healthcare. It's many people have access to medical services thanks to government programs, but these programs are very, very problematic. But also they have almost 45 million uninsured Americans. And the plan was, government officials said, hey, we must do something with this because we have almost 50 million uninsured Americans laying on the street, dying on the street. And the main reason, the main goal of Obamacare was to bring to those people medical services to insure these people. And the government created this special market called marketplaces. It was the main goal of Obamacare. Next, yeah. And why it was a problem? Because as you see on the next page, we have this is healthcare costs in the United States, and this green line is CPI for whole U.S. economy. So you can see within 45 years, the prices rose 5 times. Blue line, it's inflation for medical care services or healthcare in the United States. So this rose for around 10 times. And especially problematic is red line because it's hospital services, and you can see 20 times. So this price is, the problem is if you have no insurance in the United States, you can find some private hospital you can pay directly, but it will generate for you very, very big problems, very, very big costs. So many people try to find their own insurance plan, health insurance plan, and this is why Obamacare, this problem with uninsured was and still is so popular. Of course, the reason of problem with this cost isn't effect of free market services in the U.S. It's I won't talk about this today, but the government wanted to solve this problem again. So they created special regulations, new regulations of private health insurance market, and you can see eight very important points. So they wanted to ensure almost all Americans. We call it universal coverage. No price discrimination as community rating. So if you are relatively young, health people, you will be subsidizing other people. So we will take more money from you. You will pay a higher insurance premium because in eyes of government, you are some kind of tool. They want more money from you, from lower risks, and they want to redistribute this money to higher risk people, older people, people with serious health conditions, and many, many others. And at this point, I would like to say it's not a problem of insurance because insurance is a very good institution. It's market institutions, and insurance works very well if it covers relatively rare risks, not routine medical procedure, not people with pre-existing conditions. We have other market solutions for such kind of people. And as you see next, third point, I'm sorry, essential health benefits. It means that if you want to offer health insurance plan under Obamacare, you must have a very wide scope of insurance. You must cover many events. Events government wants from you to cover. Not you as insurance company would like to do it without government. So as the same story we have if we're talking about individual mandate. So it means it's after Obamacare there is some kind of mandatory health insurance. But if you have no health insurance, you will pay some kind of financial penalty for lack of insurance. Government subsidies for the poor because poor people can't afford even such kind of health plans, which mean new taxes for another part of society and more taxes for rich people, again, some kind of redistribution and government guarantees for insurance companies because also insurance companies needed some financial support from the state because this is very unprofitable health plans. And of course, they also created some additional requirements for employers. If you have company with at least 50 employees, full-time employees, you must offer for them special health plans created by this Obamacare regulations. So it was the idea behind this regulations and this so-called reform. In other words, politicians thought they can manage in some way market forces. They can create it. They can force private institutions, consumers to another actions. Okay, so on next page you can see a few examples of this how. These regulations worked. For example, as you see, insurer could set the premium for an elderly person at no more than 3 times than that for a young person. The market standard is or was 5-1. So this is some kind of subsidies. In turn, the premium for a smoker could be maximum 50% higher than of a non-smoker with the same insurance. So this is a few examples. You can find very much more of this. And now I would like to talk to you today about so-called death spiral. So this is a phenomenon characteristic for health insurance market. And it has 3 stages, 3 points. This is, you see on these arrows, first stage, if you have more older people with high risk, health insurance risk, you will have higher claims. So next stage, second, you will see increasing premiums, but effect of this will be very very negative because younger insured people with lower risks probably will leave and left, as experience showed, the market or switching to less coverage. So this health insurance plans was imbalanced. So not enough revenues and still growing spendings. So this is what this Obamacare regulations brought to another part of U.S. healthcare. And it is still the problem of so-called adverse selection, and under Obamacare, it cannot be revoked because Obamacare planned to cover poorer people, people with higher risk, with serious health conditions. They thought they can, at some way, manage the risk, but they couldn't. And this is, the key point, the key problem of all. If we're talking about Obamacare, this is the key problem. And now I will talk a little more about effects of these regulations. And so, on my work and also during this presentation, I will show you that this non-classical, this course of death spirals, consisted of 6 parallel or consecutive stages. And first was increasing premiums. Second, provide higher tax reliefs for lower income earners. Third, an increase in the amount of out-of-pocket expenses of the insured, especially deductible. Fourth, a decline in the number of insured persons. Fifth, lack of financial support for the insurance. And sixth, financial losses and insurance exits from the so-called marketplaces. So, as you can see, it is a big mess, and again, government tried to put more money on this, but it doesn't work. So now you see stage number 1, and this is increasing premiums. I will focus on since 2014 to 2020, so this is 7 years, enough time to check, to study, so we can say that average premium, this change, the insurance premiums increased for almost 70%. It's a very serious number, and as you see, for instance, states with the highest premiums increases, it was almost 200%. Even states with the lowest premium increases, it was more than inflation rate. So it is very very problematic, as you see. In comparison, the CPI for medical care rose by just under 19% and the CPI by 10%. And as you see, a few examples, for instance, for 27-year-old May, Silver Plan, it is most popular plan under Obamacare, increased by an average of 78%. Another example for family insurance, also it almost doubled. So this is because these regulations of Obamacare brought many people with serious health conditions, and as you see, many people left. Many younger insurance with lower risk left because it wasn't good, business for them to stay. It's if you must pay more and more and more and more. Okay. This is also a very interesting table because this is reported estimated premium increases by major insurance companies by states for 2016 year. And as you see, it is column on the right, percentage of state insured persons of all eligible persons. And market standard is, if you are insurance company, if you create some new health plan, you should have at least, or its optimum number, 75% of your potential clients or potential market of such kind of insurance plan. And as you see, in many states, this Obamacare plans reached 30%, 40%, 25%. Only in one state, it was Vermont. Yes, it was, but it's not so. You have in Vermont, you have not so many people. Only in one state they reach this optimum level of insured persons, 75%. So it's not wondering that this cost, this rises in insurance premiums was so significant. And you see also, if you look on this description column, that many private insurance reported, hey, government, we must for next year, 2016, 2017, 2018, and many next years, we must report increase in our in levels of insurance premium for our plans, because if we want to offer such kind of plan in the future, we need more money, we need more revenue, because this is the effect of this adverse selection in health insurance market. And now, stage number two, average amount of so-called tax credit, APTC, it's advanced premium tax credit. And the story was why these plans were so popular, because government told to the people, hey, we will cover at least 70% of your insurance premium. So if, for instance, for 2020 year, you can see average monthly premium for insured persons eligible for this APTC was it was around $600, but thanks to this advanced premium tax credit, government covered more than $500 of your insurance premium by month. So you, as an insured person, you paid $89. So it's, government covers 85% of your 85% of your monthly insurance premium. So people didn't realize it is very costly system. This is very costly reform, and this is why this Obamacare attracted many new insured persons, because they thought it's good business, but it generates, as you see the right column again, number of people eligible for this APTC, more than 7 millions. And if you multiply this number by this average amount of APTC, it will be another billions of dollars to deficit, or to the federal budget. So as a government, you must find many billions of dollars to fund this very costly health insurance plans, these marketplaces. So this is why this is very problematic reform, and this is why many Americans still didn't realize why this is so bad solution. And stage number three, and this is one of my favorites screens pages, because someone can say, what a problem, government covered 85% of my expenses. It's good business for me. But in health insurance plan, we also have so-called deductible. Deductible is the amount of money insured person should pay at the beginning. And the story is, for instance, what does it mean, this $3,000, okay, for silver plan, for instance, or $4,000? It means that you, as an insured person, even with very strong subsidies from government, before you will start to consume your health insurance plan, you must pay 3,000 or 4. It depends on year, For instance, if we're talking about 2020, it's more than $4,000. It means you must pay at least $4,000 from your own pocket. When you pay this 4,000 and almost $200, then insurance company starts to cover your medical expenses. So imagine poor people with very very low income, uh, uh, and such kind of many millions of Americans couldn't pay even for their health insurance premium. So, but thanks to it's some kind of irony. Thanks to Obamacare regulations, they must pay $4,000 of deductible, and after this, they will can start consume their health insurance plan. So, if you want to access to medical services, at the beginning you must pay a few $1,000s, and if we're talking about 2025, 2024, and next year, these numbers are almost doubled. So it isn't a good solution. And even if you have some, again, additional subsidies from government to cover this, still you must pay additional few $1,000s. Despite fact you are low, you are not, your incomes are very very low. So again, and the government couldn't find solution for this, because why this is so important, because there is a relation between level of deductible and level of insurance premium. In normal market, market without health insurance, market without government regulations, higher level of deductible means you will pay lower insurance premium, okay? But thanks to Obamacare regulations, you will pay higher insurance premium and higher deductible, and higher and other expenses like from your own pocket, like co-payment and co-insurance. And you must also pay additional amount of money, but deductible is very, very, very characteristic. So, and this was, and no one expected this, and after this you can see on these two examples. For instance, the New York Times cites, there was many examples, this is I show you only two, cites the example of an insured woman with a deductible of more than $6,000, which makes her visit the doctor less often than when she didn't have insurance, because then she could take advantage of the discount available to the uninsured, which is now impossible. And plenty of such kind of stories. Another example is a 30-year-old Baltimore resident with a family insurance option. While the monthly premium he pays is $275, the $13,000 deductible already makes his family ineligible for the recommended benefits, especially for his son who suffers from autism. Can you imagine? And so many people ask, hey, so, okay, we are paying very low insurance premiums, but this level deductibles and co-payments and co-insurance levels are killed us because we can't afford this. And this is the effect of Obamacare. And why many people still didn't understand this, because if you don't need to go to the physician, you don't need medical services, you see only, oh, I pay less than $300 for my insurance premium. You don't realize if you will need to go to the physician, you will need some medical tests and many others medical services. You at the beginning you must pay $6,000 of deductible or more. It depends, but it's not, for instance, $100 of deductible. It's 600, 6,000, 13,000, maybe 20,000. It depends. But this is this dark side of Obamacare regulations. And another negative example, effect, you can see this is a participation of individual health plans under healthcare insurance marketplace. These green colors, POS and PPO, it is, there are health plans uh, with a better network of hospitals and other medical centers. So this green colors, POS and PPO, are in other words, I can say they are better health plans. So you have more hospitals in your own city, okay? But these blue colors like HMO, APO, you have a lower number of health providers, lower number of hospitals, lower number of ambulatory services. And as you see, within few years, share of these worse health plans with limited access to hospitals is growing. So if we're talking about HMO, from 49% to 53%, and APO from 11% to 19%. And as you see, POS, it decreased from 12% to 6%, and PPO from 28% to 21%. So conclusion is, okay, you are paying very low insurance premium and very problematic deductible, but by the years you have worse access to hospitals, to ambulatory centers, and many other medical providers. So another especially in rural areas, okay, if we're talking where it's more difficult to find a good doctor. And another problem, because decline in the number of insured under Obamacare. And as you see, they never, if we're talking about this period since 2014 to 2020, they never had more than 12 million people. Oh, maybe, sorry, 2016, 2017, but these numbers are not so serious. So they wanted to insure much more people. And the reason, and this is even more important, because as you see, if we're talking about, for instance, some estimates for previous years, they thought they will be able to insure 25 million of Americans. But as you saw on the next page, they reached only at the best 12 million people. So imagine you are running private company, okay, and your company released some, I don't know, some new product, some new good, new service, whatever, and you hope, according to your estimates, you will reach 25 million new customers. But after this, you realize you have, at the best, you have 50% of this is what you expected. So this is why, but why people didn't want it to go to get this Obamacare plan, because they wrote story like New York Times. They saw what's going on. And I hope they see this still. So this is why they completely miss their expectations. And if we're talking about 2021 year, for instance, you can see that this number of uninsured people decreased from this 45 million to 28. Okay. And many people talk to me, hey, but it's a good statistic. So Obamacare was succeed. No. They attract poor people to problematic health plans, and many people must pay, 6,000 of deductible, for instance, or more if you have a family. You have limited access to hospitals. So, but if you look on the statistics, it looks nice, but it is only statistic. Behind the statistics, I like to say, people like to think if I have insurance, I have, fantastic access to medical services. No, 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 no. If you have insurance, if you have government insurance, you must pay more taxes. And you have very problematic access. In reality, you have no access. If you won't pay your deductible, you have no access to these services. So such kind of statistics, okay, as again, I can say it looks nice, but behind this, there is no real access to medical services. Uh, this is more data, as you see. Uh, this green and orange colors, orange color is the number of the people who resigned from insurance. For instance, in 2016, almost 4 million Americans left this Obamacare plans, but almost 5 million came. So, but as you see, the data for next years, this is some kind of rotation. So almost the same number of Americans left, and the same number of Americans, came in. So this is why these numbers are relatively stable, but still it's at the best 50% of this is what they expected. So why such many Americans, 4 millions, 3 millions left this? Because they can't pay higher and higher insurance premiums and higher deductibles. And it was a very simple calculation, because at the beginning I mentioned that according to, again, Obamacare regulations, if you have no health insurance, okay, you must pay penalty. But the level of this penalty, the higher level was almost $800. So for me, it is a better business to left such kind of plan and pay this $800 for lack of insurance than pay $6,000 of deductible. So for me, it's a discount. Of course, it's some kind of joke, but this is why many people had no problem and they left this plan. So and on the screen you can see such kind of rotation. And most popular plans, silver plans, it's some kind of benchmark, and you see share of people with this silver plans, it decreased, okay, 59%. More prestigious health plans with better access, gold and platinum, also it's the share of insured people with such kind of plans also declined from 9 to 7%, and for platinum best plan from 5% to 0. Bronze plans, so-called economic class, if we're talking about airlines, rose from 20% to 33%. So this is why people changing their plans for worse plans or left these plans. Again, another reason that this Obamacare didn't work. And next stage, Obamacare regulations, the people behind this created two important programs, reinsurance program and risk corridors. And the plan was, we want to collect some money for our private health insurance and from American taxpayers. And they believe that they create some reserve funds to cover this rising claims from insurance companies. But it worked only for 1 or 2 years. For instance, for 2015, they had, $6.5 billion, but claims was almost, more than $14 billion. So they and government have no money to do this, to cover this gap. So insurance companies said we must rise and rise again insurance premium, we must rise deductibles and many others. The same story was with so-called risk corridors. For instance, in 2015, you can read, and they collected only $20 and $40 million, but the claims was $3 billion. So government again couldn't help insurance companies, and this is why many insurance, started to generate losses, and they said we are leaving this Obamacare plans, we are leaving marketplaces. And first of them was United Health Group. It was significant because United Health Group, it is the bigger health insurance company in the United States. So they have they have big numbers. They see they saw the data, and no hesitation. We are leaving almost all states, or now, if I think all states, and only for, as you see, for 2016, they generated losses for $650 million, only for 1 year. Another health insurer, Aetna, did the same. And this is what Mark Bertolini, CEO of Aetna, said. Most payers experience constant financial stress as a part of their activities on the marketplaces, exchanges. This is so-called, Obamacare plans. Providing consumers with affordable, high-quality healthcare options is not possible without a balanced risk pool. This is what I said at the beginning. This is why risk calculation is so important, and this is why exclusions from insurance for health coverage are very important. It's not because insurance companies are greedy, okay, or greed. This is because they perfectly know that they need balanced health plans. This is why. And if you want to do this, you will see the effect like this. Another health insurer, Humana, did the same, and it was you can see the data. If we're talking about 2016, 65% of counties, all counties in United States, could choose between 3 or more health insurance companies. Okay, after few important healthcare companies, health insurance left the market. As you see, 2020 year, it decreased to 29%. So 25% can choose. They have only one insurance company. So this is very very problematic, and this is the effect of Obamacare also. And there is a famous state in Arizona, Pinal County. A few years ago, it was some kind of risk that they only one insurance, Aetna, will also leave. It was the only one insurance they had. But after some negotiations, Aetna stayed with this 10,000 of people. But was a danger they will be, they left, and the people won't have at least one insurance company. So it was also a very, very famous example. And what's going now? Okay, because I mentioned previous years. If we're talking about 2025 year, according to CMS estimates, we have 24 million people insured in the marketplaces. Someone can say, why? This is very, very simple, because some people came from Medicaid program after pandemic period. But the truth is, government has no other arguments, so they informs the public that we can cover more and more people. No matter these plans are very problematic, it doesn't work, but they have only one statistic: we cover more people. But the truth is, the reason behind this is because, as you see, for instance, just a moment, new levels of insurance premium, almost $500. It's much higher than previous record from 2018 year. This is another problem, because for 2024 year, as you see, it's average or median level of deductible it's not, $4,000 for instance, for bronze plan, it's more than $7,000. For silver plans, it is more than 5,000. It's still rising, as you see on this chart. So American insured under these plans, must pay more and more money before insurance companies starts to cover their expenses, and it's still rising. And this is the main reason why more people still, is attracted by Obamacare, because as you see, if your income is even above 400% of so-called FPL, this is federal poverty level, you may now qualify for the premium tax credit that lowers your monthly premium for marketplace health plans. So it means if you are a relatively rich person, okay, you are not poor, you can get your discount for your insurance premium. This is why almost all, for around 24 million Americans are insured, under this Obamacare plan, despite fact that levels of this insurance premiums, deductibles are still rising. And this is the study showed that across over more than 100 insurance, they propositions of increase of insurance premiums for next year, and the median, not even average, but median is at 15%. So we can say that for more than or around 50 insurance companies, okay, there are data for 19 states, but it's not complete data, but it's again there are very problematic data. So at least 50 health insurance health companies said probably in next year we will rise, we will increase, your insurance premium for at least 15%. And probably we will also increase your deductible, your copayment, and many, many others. And what will be the result of this? The result will be that people, as you see here, that people, relatively younger people with lower risk, again, will start to live these Obamacare plans. So this death spiral circle, you probably it will be another stage of this death spiral. So why? Because as you see, this enhanced premium tax credits that make coverage for affordable will expire at the end of 2025, driving up out-of-pocket premium payments by over 75% average. This is expected to cause healthier enrollees to drop their coverage and create a sicker risk pool. As in most years, rising healthcare costs, both the price of care and increased use, are significant driver for increasing rates going into plan year 2026. So artificially increased demand, limited access to medical services. So I am not wondering this, this 24 million people will, they will have many problems in next year, and still this problem, this is the same effects like this. I mentioned this period 2014, 2020. This is the same story. This is still the same, and despite fact government put more and more money, it still doesn't work. And I think a lot of my charts, you can see this is in one picture. It very well, I think, represents all problems with U.S. healthcare. On green line is lowering a share of direct payments, and this red line is there are some insurance options, government, private health insurance, also Obamacare plans. And if because if you're paying directly, it's natural pressure for suppliers for lowering costs. But this share of health insurance, especially regulated health insurance, is still rising. You as insurance, insured as American, this is why they didn't see how costly this is. So this gray bars, it's healthcare cost, healthcare spendings per capita. This is why they have a higher healthcare spendings per capita and in relation to GDP in all world. And short summary, economic calculation and risk pricing is crucial for insurance. The established marketplaces have not facilitated American access to affordable healthcare plans. And this is also very Austrian point of view, because we, as an Austrian economist, I can say economic calculation, risk calculation matters. Very important is also competition, and Obamacare plans limited this competition. Still, many people don't understand this, many Americans, because this is a very simple reason. If I have no reason to go to the doctor, I won't see my deductible. I won't see my problems with my insurance premium, that for next year I will must pay, for instance, 15% more and more and more and more. And this is why. In short literature, and I can recommend, if you want to study this subject, my book, The Economics of Obamacare. And this is critical, of course. I analyzed these reasons why they wanted to introduce this, and effects of this Obamacare, also not only for so-called marketplaces, but also for pharmaceutical market, Medicaid, and many others. And this book, On the Right, Markets versus Public Health Systems, Perspectives from the Austrian School of Economics, is my first theoretical book about this, how real, unhampered, health insurance, health system without government regulations should work, and why this is better than government solutions. So if you want more about all my works, you can also find my profile on Mises Institute, American Mises Institute, and you can find my essays also about US healthcare. So thank you very much for your attention. And if you have some question, I don't know, Błażej will read these questions for me. Okay, so
Yeah.
wait.
Basically we can organize it in this way, that the question that came to us through Q&A, at this point, I will read them out first, and later on, if someone additionally wants to ask the question, they can choose to raise their hand, and I can unmute them, or they can just ask also on the Q&A panel. So yes, the first question coming from Edward Knapp would be, I've been told healthcare pricing is determined by a board of medical and insurance professionals. Is this true? That would be the first part of the question. So later on, I will read the rest.
Could you repeat? I'm sorry, this second part of this question. I mean, this area.
I've been told healthcare pricing is determined by a board of medical and insurance professionals. Is this true?
I mean, is this true? Because they must deal with government regulations. So it's not, if you mean market forces, there is no market forces, market forces in United States are not behind this pricing. So as I said, if you are a health insurance company, you must deal with this with this regulations brought by Obamacare, and I didn't mention about this. And before Obamacare, if we're talking about health insurance market in the United States, it was also very heavily regulated market. Obamacare regulations is just next stage of the same process. Okay, so there is no demand supply relations behind prices of health insurance plans. If I correctly understood this question.
Yeah, no worries. I will add because those were two
Hmm.
questions together. So
Hmm.
I will ask the
Okay.
second part
Okay.
of it. So maybe it will be more clean then. Also, in the USA, doctors are not allowed to advertise their prices. If this is the case, would price competition help lower healthcare costs?
Yes, there is another big problem with so-called price transparency in the U.S. healthcare system, because if you have your health insurance, you can't see whole cost, the real cost of medical services. You only see your health insurance prices, and if you, for instance, go to your doctor to the hospital and you would like to ask, hey, could you show me my bill for this whole um, my hospital services, they won't get it to you. You can reach this because hospitals and many physicians don't want to show you how costly the system is because they can say to you that, oh, we have some problems with this data you asked for. Of course, it isn't the truth, but it's some kind of the problem with very serious problem with price transparency. If you are insured under Obamacare, if you have your employer-based healthcare, okay, I mean health insurance plan, the situation is the same. It's very difficult to know what is the real cost of my health insurance plan, medical services, and many Americans have no idea uh, if we're talking about, because for instance in Poland, if I go directly to the physician, I can pay $50, for instance, or $100 for a visit. I understand how costly it is, okay? In America, it's not. And this is another problem, so you are right.
So another question would be going from Amanullah Shulvo. Sorry if I butchered the name completely. What should be the solution then against this problematic healthcare system? What would you propose, Lukasz?
Well,
How to resolve
well,
it?
solution is very simple. Mass deregulation, delayed American Medical Association, delayed FDA, and FDA it's Food and Drug Administration, delayed Medicare, Medicaid, delayed Obamacare, delayed everything from government. Of course, I'm joking, not so easy, but we can find few solutions. First, I like to mention very often. I mention famous American private hospital, Surgery Center of Oklahoma, and they are special because you can go to this hospital, but you can pay only directly. So they won't cooperate. They doesn't cooperate with insurance, and both public insurance and private insurance. So if you're paying directly, this level of prices for very costly medical services. I mean hospital services. I'm sorry. It is 6 to 10 times lower, not 6%, 6 to 10 times lower than you can. I'm sorry, you can get from your standard hospital. For instance, I talked with one of the owners of this, Dr. Keith Smith is one of the owner of this surgery center of Oklahoma, and I've heard many stories. For instance, some patient, some hospital, another American hospital wanted to charge some patient for $40,000, okay, for some operation. And this patient then went to the surgery center of Oklahoma, and Dr. Smith calculate costs, and they said, hey, it will be, how much? $4,000 for with hospitalization for all, 10 times lower, only because they are outside of this problematic this they because they don't cooperate with health insurance. So there is no this artificial increase in demand in insurance premium, and they can reach the profits. So you can just Google Surgery Center of Oklahoma. You can visit their website. You will see prices for medical services, something what many Americans can't even imagine. you know. So simple. Prices for, you can see prices for your burger, for your barbecue, yeah, but you can see a price for your medical services and for surgery, for instance. But if you're talking about Surgery Center Oklahoma, yes. Another good example, a fantastic healthcare reform they made in Montana state, so-called direct patient care, and they created special health plans. For instance, average you pay $80 per month, and you have access to many physicians, and you can go to them. You can make some medical tests, many others, and this it's average, I think, 70 or $80. Okay, and this is all your bill. So no deductibles, no co-payments, no any additional costs. This is how we can do it. But the key point is we must deregulate the supply side. So we need many physicians. American United States need more physicians because so you must. But the problem is for AMA, so because this is American Medical Association, because they blocked many talented students, future physicians. They can reach the universities because they can get access to these universities. Because there is, they want why? Because lower number of physicians means higher salaries for them. This is very simple. So this is my answer.
And the other question would be rather rhetorical. So let me ask a second one also in a small pause. So Obamacare seems to look good on paper, but in reality, low premiums often come with high deductibles that makes care inaccessible. How can this be called affordable healthcare if people still can't afford to use it? So
Yeah, this is the slogan, political slogan. I can. It was, a few months ago. I was in the United States in Alabama at the Mises Institute because I received scholarship from Kościuszko Foundation. I was able to, made my research grant, and I talked with Uber driver about this. And I talked to him, man, this you have so problematic, this Obamacare plans. Um, and the guy told to me, I have Obamacare plan. I like my Obamacare plan. And I talked to him, why do you like this? And oh, because I'm paying. They cover for around 80% of my insurance premium. It's fantastic. It was a guy who had, I don't know, 30 years old. And I asked him, okay, do you know what is deductible? And no, he didn't know. So this financial knowledge, not only economic knowledge, but financial knowledge. I mean, knowledge about financial products like insurance, health insurance. This is also a very big problem in the US because the guy, and I told to him, if you, again, the same story, Michael or whatever, Michael, if you will need to go to the doctor, I hope you have on your bank account $4,000 or $5,000 because this is the level of your deductible. Did you know this? No, what are you talking about? I'm talking about that insurance told you must pay at the beginning $4,000 or $5,000, and after this they will start to cover your expenses. And the guy was shocked. This is so simple, so easy. This is why, again, Obamacare attracts so many people. And I go to the Mises Institute again, and I talk to Dr. Thornton, Mark Thornton. Dr. Thornton, I have the story for you. I talked with some guy, Uber driver. Maybe I don't understand something, and I told him the same story. He told to me, no, look, this is, why many people in Americans have no idea how really it looks like. So this is so simple. I was shocked. Even today I'm a little shocked. That's But what we can do. We can show the data, real data.
Our next question would be, statistics shows that while ACA plans lower premiums, the average deductible for a silver plan can exceed $4,000. How does the policy addresses the risk that these high out-of-pocket costs discourage people from seeking necessary treatment?
This is very simple because politicians, some supporters of this, Obamacare reform, just hide this data. They will tell you you will receive advanced premium tax credit, okay? And this is what you will see in your, I don't know, some tax form when you will try to deal with IRS, okay? So you as an insured person, you will see how much money you can save thanks to Obamacare, because so they show you your advanced premium tax credit, but they won't tell you about deductible. So they and this is it's some kind of illusion and some kind of moral hazard from politicians, because politicians still think they are able to hide this data. And why people don't go to the street and they won't protest? Because at the same time they don't need to go to the doctor. It's spread in time, because idea of insurance is that, for instance, if you have, I don't know, 1,000 insured persons, okay, for instance, one or two or three will need go to the physician, will need to treatment or for treatment, okay, not at the same moment in time. This is why, and government focus on insurance premium because you as an insured American, you are paying insurance premium by month. This is why they want to cover 80% or more of your insurance premium. But it is moral hazard, and it generates also additionally deficit for federal budget. You can't hold this system for, or maybe you could hold this for next decade, but imagine that relation of public debt to GDP will be 200% thanks to Obamacare and other Medicare plans too, and this is the answer. And this is very simple. I know it looks like, I would like to say many Americans are just dumb people, and maybe it will be a little controversial, but truth is, it's very, very, again, there is no need to study advanced economic books. This is, just few simple statistics, not more.
Uh, Perfect.
Which to
There is two
yeah,
hands up.
that's what I wanted to do right now.
Sorry, sorry.
So Valentino would be going first because I saw it's been waiting for a while. So let me just add Valentin. Okay, you can unmute yourself.
Hello?
Perfect. Hello, we can hear you.
Okay, that's perfect. So I was wondering if I understood this correctly, younger people avoid higher premium plans because of the higher risk factor that sick people and old people introduce because of Obamacare. But my question is, where will these people, for example, chronic disease people like leukemia, cancer, or even autism, as we saw before, where can these people find an insurance that covers the medical costs? Because these tend to be very high, right?
So before Obamacare, poor people with serious health conditions, it was this was a group of uninsured Americans, okay? And now if we're talking about this time, for instance, 20-25 year, you can find these people insured under this Obamacare plans. But still, this is the group, most determined group, which want to hold this health insurance plan, despite fact that this level of deductible is still rising, insurance premium is still rising, because for them, it's still some kind of, discount for relatively cheap treatment, okay? But such kind of plans are not stable because many younger people, and as you mentioned, left these healthcare plans. So this is the effect I will try to show you. For instance, this is this fatal circle of so-called death spiral. Oh, as you see here. So it's such kind of plans always, younger, maybe not, people with so-called lower risks. Younger people will live, at least part of them, if, for instance, even, I don't know, a few percent of this, such kind of people, if, for instance, I don't know, few percent, 5% of lower risk will leave the market, it could be start of this death spiral. Because in next stage, insurance company will must, rise the premiums. So another younger people with lower risk said, hey, I'm not going to the doctor, okay? I have a good health. Why I must pay more and more for my insurance premium? Why I have so high deductible? Why? Because in the normal market, if I have higher deductible, I should receive lower insurance premium. But Obamacare regulations are so problematic, are so, destructive. Oh, this is correct word. That even you paying more, higher and higher deductible, you also must pay higher and higher insurance premium. And if such kind of people with higher risk also decide to, I can't more pay for this, okay, so there is no alternative for such kind of people. Well, such kind of people should go to, for instance, Surgery Center of Oklahoma. So this is the alternative. Direct payments or charitable institutions. This is market alternative for this problematic healthcare plans. If you want to ask more, because maybe if I understand correctly your question.
Yes, that was basically my question, how they would pay for these treatments in the free market, and I think you answered it. Yeah.
Directly, and it won't be a problem. It's more cheap for them than under insurance plan. Or if even they couldn't afford this, always we have. I like this example: charitable institutions. If I just a moment, you can find my essay on Mrs. Institute website about this. Just a moment. If you find my profile on this website, you will find an essay about this the role of charitable institutions.
I don't see anyone else raising their hands at this point. So thank you very much, everyone, for joining. This is the first webinar out of our series of 21st Century Challenges. The next one will be taking part in also on Wednesday next week. It will be topic of the war in Ukraine by Tanya Rak. So right now I wanted to thank you, Lukasz, very much for your presentation. I saw that plenty of people also appreciated that. So I hope to see all of you guys next week. And remember to take the certificate for all the participation in the webinar series. You need to attend at least 4 out of 6 of those webinars. So hope to see you next week, and thank you very much for the participation today with us.
Thank you,
Mario,
Lukasz.
do you want to add something?
Everybody. No, just thanks to our speaker, Lukasz. Thank you really much. As medical student, I really appreciate it, and thank you everyone here to follow the webinar. So see you soon.